La COVID-19 représente la plus grande
COVID-19
crise de
represents
santé
the
publique
biggest
que
public
notre
health
pays ait
crisis
connue
that our
en un
country has
siècle.
confronted in a
From the
century.
onset of the pandemic, Canada's public health system was thrust into the spotlight as the first line of defense against the SARS-CoV-2 virus. Public health has always worked behind the scenes to protect and improve the health of people across this country, but our work has become much more visible during the past 2 years. Chaque année, dans le cadre de
Every
mon
year,
mandat,
I
je
deliver an
présente un
annual
rapport
report on the
annuel
state of
sur
public
l'état
health
de la
in
santé
Canada
publique au Canada.
as part of my
Cette
mandate.
année, nous nous
This
trouvons
year,
à un moment
we
critique.
find
Nous
ourselves at a critical
continuerons de
juncture,
lutter contre la pandémie et nous nous
still
tournons
responding to the
également vers le
pandemic, but also
rétablissement.
looking towards pandemic
Dans mon
recovery.
rapport, je reviens sur la
I
gestion de
reflect
la
on
pandémie au
Canada's
Canada
pandemic
et je
experience
propose des
and
mesures
propose
clés
key
pour
actions
renforcer
to
notre
strengthen our public
système de
health
santé publique
system
et faire en sorte
and
que nous
ensure
soyons
that we are
mieux
better
outillés pour
equipped for
l'avenir.
the future.
I often say that as Canada's chief public health officer, the population is my patient. Instead of taking care of individual patients, public health is concerned about the population's health as a whole. Its mission is to prevent injury and illness, promote healthy behaviors, and to ensure that all people have an equal opportunity to stay healthy and well. La santé publique, c'est l'éclosion
Public
qui
health
n'a pas
is
eu
the
lieu,
outbreak that did not
le
happen,
traumatisme qui n'est pas
the
arrivé,
traumatic
et la
injury that
surdose
did not occur,
d'opioïdes qui a
and the
été évitée.
opioid overdose that was avoided.
COVID-19 has been a stress test for Canada's public health system. Over the course of the past 2 years, we have witnessed our public health system switch into overdrive as it rapidly adapted to meet the challenge of protecting our health during a global pandemic. And incredibly, it rose to the occasion, but at a serious cost. Our public health system has been stretched dangerously thin, and it is in need of critical reinforcements. Comme nous l'a rappelé l'émergence du
And as the
variant
emergence
Omicron,
of the
la
Omicron
santé
variant
publique
of concern
doit
has
être
reminded
prête
us,
et capable de
public health must
réagir
be
à tout
ready
moment
and able to
lorsque de nouvelles
respond at a moment's notice
menaces pour notre
when new
santé
threats to our health
surviennent. The call for
emerge.
public health renewal in Canada is not new. It has been echoed by many others in the field over the years, including past chief public health officers in annual reports dating back to 2008. Toutefois, la pandémie de COVID-19 a servi de
However, the
signal
COVID-19
d'alarme
pandemic
important.
has served as
The
an important
COVID-19
wake-up call.
pandemic has served as an important wake-up call. Simply put, we were not prepared to face a public health emergency of the magnitude of COVID-19. We can no longer dismiss the voices or delay necessary actions. There are increasingly urgent signs that we need to act now. As I discussed in last year's annual report, From Risk to Resilience, an equity approach to COVID-19, people in Canada were not on an equal footing when the pandemic took hold. Broader inequities in our society, including colonialism, racism, and other forms of discrimination and stigma, have resulted in disproportional impacts of COVID-19 on the health of some populations in Canada. Cette année, la lutte contre la pandémie
This year,
demeure la
fighting the
priorité
pandemic
absolue du
remains
Canada.
Canada's top
Mais d'autres
priority,
défis complexes en
but other
matière de santé
complex
publique
public health
nécessitent
challenges also
également une
require
attention
urgent
urgente.
attention.
Il s'agit notamment des
These include
effets des changements
the
climatiques sur
health
la santé,
effects of
de la
climate
crise des
change,
surdoses
the
d'opioïdes,
opioid
de la
overdose
résistance
crisis,
antimicrobienne et de la
antimicrobial
dégradation
resistance,
de la
and
santé
worsening
mentale.
mental health.
We know that the same people who felt the impacts of COVID-19 more severely will also be those harder hit by other health crises. We must take action to ensure that everyone in Canada is equally protected and able to achieve their optimal health moving forward. Canada's best defense against future public health threats is a strong public health system and a healthier population. Dans mon rapport, je décris
In my
4
report,
domaines
I
d'action
describe 4
prioritaires
priority
visant à
areas of
stimuler la
action intended
transformation des
to
systèmes de la
stimulate
santé
public
publique.
health system transformation.
First, we must renew and reinvigorate our public health workforce. The pandemic has seriously impacted public health workers across the country, with frequent reports of burnout. Après près de 2 ans de lutte contre la COVID-19, beaucoup de
We
travailleurs
must
en
work to
santé
recruit,
publique sont
retrain, and build the
épuisés.
next generation of
Mais
public health
heureusement, la pandémie a aussi
professionals,
suscité un
after
intérêt
2 years
accru dans
of
le domaine
this
de la santé
work.
publique. We must work to recruit, retain, and build the next generation of public health professionals with a highly skilled, diverse, and inclusive workforce that best reflects the communities they serve. Surge capacity is also required to rapidly expand the workforce in times of emergency. Second, our public health toolbox needs some serious upgrades. There
is no doubt that our pandemic response was impacted, in part, by significant gaps in our public health surveillance and data systems, including a lack of data on race and ethnicity, a lack of comparable data between provinces and territories, and information gaps at the local level.
Working across federal, provincial, and territorial governments, a pan-Canadian health data strategy is underway to address these gaps in a secure and ethical manner. However, its timelines must be accelerated to ensure that public health has the right data at the right time for effective decision-making. We also need to strengthen a Made in Canada research agenda in order to identify which public health interventions are most effective to improve the health of populations and reduce health inequalities.
Third, we need to modernize our government's models and collaboration structures.
The pandemic has demonstrated once and for all that we cannot work in silos and that complex public health challenges require a whole of society approach, working together across jurisdictions, sectors, industries, communities, and borders. We must ensure that these efforts are better supported with collective action based on clear and measurable indicators to understand if we are meeting our goals of achieving better health for all. Les collectivités de Premières Nations,
First Nations, Inuit, and Métis communities must also be supported in developing their own public health priorities, plans, and solutions. Finally, appropriate investments are key to enabling these advances in our workforce, tools, and governance.
As we have seen in the past, public health resources are often scaled back after public health emergencies as governments move to address other priorities. This is referred to as the boom and bust cycle of public health spending. This
places the public health system at a disadvantage at the onset of each crisis by not having the capacity or the networks required for a rapid response. It also impacts public health's capacity more generally, as its objectives, disease prevention and health promotion, are much longer term.
My hope is that the recommendations outlined in my report spark a much needed national dialogue and catalyze collective action on public health renewal. However, key to this will be a fundamental shift in the way we think about health and value health in our country. An effective health system is more than treating illness through medicines and hospital procedures. It means preventing these illnesses from happening in the first place.
In fact, these systems are complementary. By keeping people healthy, our public health system reduces the burden on our healthcare system and contributes to its sustainability.
As people of Canada, we value our healthcare system. It is built in the social fabric of our country. We must come to value prevention and wellness to the same extent that we do medical treatments and care. I would like to conclude on a positive but pragmatic note. Canada's public health system is not perfect, and significant work lies ahead in terms of our transformation process. We must get ready to roll our sleeves up. But I've always had great hope and confidence in our system's vast potential. And I know that many of my counterparts at provincial and municipal levels are equally optimistic. C'est la masse des encore plus. However, to fully realize our vision of a world-class public health system, we must all be invested. The public's health is a responsibility that we all share. We have seen examples of greatness throughout the pandemic, including the largest mass vaccination campaign in Canadian history, which mobilized many sectors and individuals to great success, Indigenous ownership within the pandemic response, and innovative local efforts to help community members in need. This is just a glimpse into what is possible when we all work together. Public health is for everyone, by everyone, joining forces across communities, governments, sectors, and internationally. We can build a public health system that best serves us all and supports a healthy and thriving society. It is in working together that we can make sure we get it right. C'est en travaillant ensemble
joining forces across communities, and working together that we can make sure we get it right. Yeah, thank you.
Happy to take questions.
So just before we take questions, Dr. Tam, your feed is lagging quite a bit. So I've been told that it may be because of your artificial background, so it complicates the task of the interpreters. But we'll just continue like this, and if the lag continues, I'll just ask you to turn it off.
Okay, thank you.
Opérateur.
Thank you, merci. You may press star 1 at this time if you have a question. Vous pouvez appuyer sur étoile 1 si vous avez une question. The first question is from Dylan Robertson from the Winnipeg Free Press. Please go ahead.
Hi, Dr. Tam. Thanks for taking our question. Your report mentions throughout the need for consistent funding for public health, but from what I read, you're not advocating for a separate transfer or a change to the Canada Health Act. So can you please explain why you aren't making those specific recommendations?
Yes, I think as one can appreciate, there are bigger policy discussions that need to be had. This report stimulates those discussions. There are different policy options for decision makers in terms of how to sustain that funding for public health. I'm also not just saying that we must just ask for more resources. What I'm advocating is a better definition of the public health mandate so that everyone understands what we're being asked to deliver on. Have frameworks and indicators aligned to common national level priorities and objectives, and be funded sufficiently on an ongoing basis, sustain some of our very critical foundations. And so I think that is, I would hope that this report supports some of the discussions taking place, I'm sure, in the very near future on the Canada Health transfers and the funding for provinces. But I would be very happy to contribute to those discussions as our political decision makers undertake those in the days and weeks and months to come.
Opérateur, juste un petit instant. So
Operator, just a moment.
Unfortunately, I'm just going to ask you to, yes. I'm just going to ask you to take out your artificial background because the lag is continuing. So. Is continuing. So.
Okay, this will help.
Thank you.
Okay, let's see how that goes.
Question.
Yes.
Hopefully it'll work.
For a follow-up question, Dr. Tam, I'd like to know about, I'd like to ask about COVID rapid tests and inconsistencies in how provinces are rolling these out. We know that in some provinces, rapid tests are widely available. In others, like BC and Manitoba, the vast majority of people have never seen a rapid test. I know that epidemiology is always local, but I'm wondering what you make of that inconsistency and if you have any concerns about jurisdictions that have tests, but they're not actually being widely used.
Well, I think to combat something as complex and as wide-reaching as the pandemic of COVID-19. We need to use everything we have available to add those layers of protection, of which rapid test is one. So I think from the federal level, you can appreciate that support has been provided in supplying the rapid tests, but it's very difficult for the federal government, who isn't working on the ground, to figure out where those rapid tests are best utilized. So what I'm trying to do together with the Chief Medical Officer is discuss best practices and provide guidance in how rapid tests are used, but it is up to local jurisdictions. So I talk about governance quite a bit in my report. It is important for us to look at how this share responsibility for public health work in our federal, provincial, and territorial context, in our federated context. It is not easy, but I think the role of the federal public health agency is to provide the technical support needed and to share best practices as we have it. So I can't answer your question directly, but I think through those kind of influences, the supplies, the financial and other resource supports, we're hoping that communities all get access to the tools that they need.
Prochaine question.
Thank you, merci. La prochaine question de Catherine Lévesque, la presse canadienne. La parole est à vous.
Oui, merci beaucoup.
Thank you very much.
Bonjour, Dr. Tam, Dr. New.
Good afternoon, Dr. Tam and Dr. New. I wanted to come back a bit at what requests you've made. Is there a figure that exists in terms of investments? Is there a certain amount that you'd like to see given to you from the federal government in order to achieve your objectives? In my report, I say that appropriate investments are essential in order to achieve our objectives. Now, there isn't a given figure for investments in public health, but without compelling evidence, I'd say approximately 6% investments in health have been spent on public health. So is that enough? Well, I think that will be a question to be put to our leadership to discuss. But I hope that my report will contribute to the discussions over the next few months as to federal investments and the transfer for health.
I think what I'm trying to do is to really stimulate a national shift in our thinking about health. My ambition is to build a future where public health is viewed as central to our daily lives, so that public health is as invested in an appropriate way as our healthcare system is as well, and working in complementary ways to healthcare. But is 6% investment in public health, and that's not equal across Canada. Some public health sectors across our country at the local and provincial levels, even less than 6% of the healthcare spending of the global federal transfer as well. So is that enough? It's not enough if you think about the fact that keeping our population healthy is as important as it is for treatment.
Ever wondered how you can simplify the hiring journey and secure top talent faster? Say you're looking at hiring Jenna, a candidate who just
as it is for treatment.
C'est Dr. New. Peut-être je peux aussi
This is Dr.
souligner
New
quelques
here.
points
Perhaps
que
I could
Dr. Tam a
emphasize
déjà
a few points
constatés.
that Dr. Tam has already mentioned. It's really important to recognize that public health systems are is a bit of a different thing from the health care provision across the country. So it's important to recognize the importance of that public health system compared to healthcare delivery. If we have a great many injuries, it's obvious to everyone that, yes, we need more doctors to deal with those patients. But public health, it's always different. How can we show what the results are? It's an issue of prevention and promotion of health. How can we demonstrate how many illnesses we manage to prevent? So that's really the challenge for public health. And I think that Dr. Pam, as she said, really hopes to launch the discussions and in terms of our leadership and authorities, the ministers, etc. Thank you. Yes, we need sustainable investment as well, because now
up and down like this.
It's zigzagging right now, and that's really not a good strategy.
Merci pour la précision.
Thank you for that clarification. So, healthcare, on healthcare, on that perspective, what are your specific requests for the Public Health Agency of Canada? Do you have a figure, once again, in mind? What kind of budget do you need to achieve the objectives you laid out in your report? Yes, I want to say there will be other reviews. There will be other studies. During the pandemic, the COVID-19 pandemic, but as is the case with other entities in healthcare and public health, we have been impacted by the same investment cycle, boom and bust, and this is zigzagging amounts of money given to us, so it's really not a good system for us. During the pandemic, we have had a lot of resources,